Hello there. We just described blood, the fluid connective tissue, as one of the components of the cardiovascular system. Let's start talking today about the heart, which is the other component of the cardiovascular system. This is the pump. It's a muscle. It's the muscle that is going to pump to push. This muscle pushes the blood through the blood vessels to be distributed throughout the body. And the unstoppable heart, we don't want it to stop. This small organ, this is rather a small organ, it consists of mostly cardiac muscle tissue, but this organ is hollow inside and is very small. It is true, it's about the size of your fist and weight less than a pound. I mean, pretty important organ, very important functions, but it's rather small. Where is it located? I hope this is not new for you, but remember we described the mediastinum. So it's located in the thoracic cavity, right inside the mediastinum, which is the central cavity in between the two pleural cavities. Is the biggest organ actually of the mediastinum. The rest of the organs in the mediastinum is the trachea, the thyroid, and the great blood vessels. And behind there, the trachea is the esophagus. Thymus, another gland, but when we were younger. Those are the components of the mediastinum. Now, see, there is located in between the right and the left lung, and it sits right on top of the diaphragm muscle, the main inspiratory muscle that divides the thoracic from the abdominal cavity. Now, when you see it projected through the thoracic cage, through the bony part of the thoracic cage, you can precise pretty well the location of the heart. And it's so located, it is located right behind the sternum, right in the middle of your chest. It's not on the left side. It's right in the middle of your chest, right behind the sternum. So we call it we say it is retrosternal in location. The thing is that it's located like in a diagonal, oblique. So the tip of the heart points to the left. But it's not that the heart is located towards the left or in the left side. It's located in the middle. Maybe most of the heart is located towards the left side because it's kind of tilted. Okay, so, and because it's tilted, it makes, and let me show you the corners. The right side of the heart lies at the level of the third and sixth intercostal costal cartilages, and the left side into the, this is the third, this is the sixth, and here upper. This is the second, and this is the fifth. Okay, so it's like that. And the important one that I want you to remember is this one, the inferior and left corner of the heart that lies at the level of the fifth intercostal space. So how do you get there? Well, remember, you feel the sternal angle, your bump, you slide your fingers, okay, towards the left side. You're going to have in between the two fingers, in here, you're going to have your second rib. So the index you have it placed on the first intercostal space, and the middle finger is placed on the second intercostal space. And then you start moving down, counting the intercostal spaces until you get to the fifth. And it's located in the fifth intercostal space at the level of the mid-clavicular line. Remember those anatomy surfaces, surface anatomy landmarks, right? So right in the middle of, if this is your clavicle and this is the mid-side, or the middle of the clavicle, just about in here is located in the middle of the clavicle. So you trace a vertical line down, and that's your mid-clavicular line. So in the intersection of the mid-clavicular line and the fifth intercostal space, that's where the apex, or the inferior left corner of the heart, is located. And I'm just describing this because it's the only one that we can palpate. The heart is on a diagonal, as I said, but also the posterior part is deeper, and the anterior, or the tip, this part, is deeper, located in the thoracic cage, and this part is tilted anteriorly. So this part is closer to the skin, and you can actually place your fingers, do it right now, on your fifth intercostal space, mid-clavicular line, close to your left nipple, maybe 1 centimeter medial to your left nipple. In there, you can feel your heart beating, and that is called the apex of the heart, because the heart has this cone shape, as you can see, looks like a cone. So the base is pointing superiorly, and the apex, or the tip of the heart, points inferiorly, anteriorly, and to the left. What else do we have to say? Okay, look at that. See, this is the base, this is the apex, located in between the two right and left lungs, in the middle, but tilted towards the left side and resting right on top of the diaphragm. This is how it looks on, well, this is a cadaver. So here you have, this is the heart, this is the diaphragm muscle, this is your diaphragm. In here you can see the right and the left lung, how it partially covers the heart. So this lobe is partially covering these parts of the heart. And in here you can see the ribs, the intercostal muscles. You can see here that looks like the aorta. I will need to remove this to see if that's the aorta or the pulmonary trunk. But this is a vein, the superior vena cava. This, do you recognize this? This is your trachea part, or windpipe part of the respiratory system, and this is the thyroid gland. Behind this, and just, for the sake to be oriented inside the mediastinum, behind the trachea, we're going to find the esophagus, right there, attached almost to the esophagus. Now, remember, almost every organ comes in a gift bag. So the gift bag of the heart is called the pericardium. And this is not new for you. We have described this right at the beginning of this course, when we were describing the serous membranes. We described the pleura, remember, holding each of these lungs, and we described the pericardium, which is this sac that encloses the heart. Now, the pericardium has these two layers, a fibrous and a serous pericardium. And here we can see part of the fibrous pericardium, and this is called fibrous. You can see the fibers in here, how it attaches or anchors the heart to the diaphragm and to the great blood vessels. They're getting out or inside the heart. Now, in here, this is another view. In here we have the heart with a frontal or coronal section, so we can see how it's hollow inside. But let's concentrate now in the layers, in the covering layers or membranes of dense. This one that I'm just talking about, the fibrous pericardium, is dense connective tissue. And see again in another view how it's like anchoring or linking the heart to the great blood vessels and down here to the diaphragm. Now that's one of the layers of the pericardium sac. So the fibrous pericardium. But we said that we have, and that's, okay, this is an enlargement. This is an enlargement of this area, okay? So in here, we are right here inside the one of the chambers of the heart, and this is the wall of the heart, and this is the covering, this is the outside. So we just described the fibrous pericardium, and we said that we have also a serous pericardium, right? That's the inner layer of the pericardium. This serous pericardium also have two layers. One is the parietal pericardium, which is this one that it faces, okay, or is, it faces the fibrous pericardium. So this is your fibrous pericardium, and this is your parietal layer of the serous pericardium. And we have a second layer. If not the parietal, this facing to the wall, the one facing to the viscera, the organ, is called the visceral pericardium. And as you remember, guys, I'm going fast because I think we're repeating a little bit from the first chapters of the class of this course. But as you remember, this is the visceral in green, the visceral pericardium. And both layers are actually continuous, the parietal and the visceral. Okay, the visceral is covering the entire organ, and when it gets closer to the blood vessels, great blood vessels, it folds to create the outermost layer, which is the parietal pericardium. Now, in between these two layers, in between the parietal and the visceral pericardium, we have a space that we call the pericardial cavity, which is a very tiny, almost virtual space that is filled with few milliliters. I guess it's like less than 5. I don't remember the exact amount, but it's around there. This little of fluid, and this is, since these are serous membranes, this is a serous fluid produced by the cells forming this serous membrane. So they create this serous fluid that is kind of slippery, that what it does is that avoids the friction between the parietal and the visceral layer as the heart contracts and relaxes, okay? Now, and I think I have that, I cover, I'm sorry, pericardial cavity, okay? So that's the covering, that's the sac there, or the bag where you are going to place the heart, the pericardium. 2 layers, the fibrous and the serous pericardium, and the serous pericardium has again 2 layers, the parietal and the visceral. Now we're going to describe now the wall of the heart, which is this part, okay? Not the covering, we already described that, okay? Not this, now this part. We have 3 layers in here. The innermost is facing inside the heart, so it's in contact with the blood, which is this one. Then we have one in the middle, which is this one, this muscle layer, and one in the outside, which is this one. And as you can see, this one is the same as this one, okay? So these 3 layers are called the epicardium, which is the same visceral layer of the serous pericardium. It's the same, okay? So that's the epicardium, connective tissue. The second layer of the heart is the myocardium, in the middle, and it consists of cardiac muscle tissue. All of this that we can see in here, all of that pinkish area, all of this is myocardium. And the innermost layer, the one facing to the inside of, lining the chambers of the heart and forming also the valves that we will describe, that's the endocardium. And the endocardium is an epithelium, is lining something, right? Epithelium either covers or lines an organ. So it's lining these chambers. And this is simple squamous epithelium and is continuous with the endothelium of the blood vessels. As you remember, it's also simple squamous epithelium. Okay. Oh, let me describe a little bit more of the myocardium. Now, the myocardium consists of, and this is again also a review, cardiac muscle cells. Remember, these cells compared to the skeletal muscle cells, these are shorter, and remember, skeletal muscle cells is a long cylinder and it has like 100 of nuclei. These one are short cells, branching cells. See how these branches in here? Branching cells, and it has 1 to 5 nucleus, usually 1 to 2, but you can find cells with 5 nuclei. It's striated, as you can see. Remember, it has the same striations, same sarcomeres that we described on the skeletal muscle system with slight differences. It has like the T-tubule, the sarcoplasmic reticulum, a lot of mitochondria that is providing the ATP to power the muscle contraction. So this is an aerobic muscle. And this muscle contracts following the same sliding filament theory that we described on the skeletal muscle tissue. Not exactly the same, but pretty much this. It's pretty similar. And remember that, which is very important, this is one muscle cell. This is another cardiac muscle cell. This is another one. And this is another one. I don't see the boundary of this one. But as you can see, they are bound together by these connections that we called intercalated discs, that I hope you remember as well. And these intercalated discs are very important because are actually intercellular junctions, or like patches that allows the muscle to contract all at the same time as one organ. We can, if you remember when we were talking about the skeletal muscle system, you can isolate specific parts of a skeletal muscle depending of one muscle, depending of the action that you want to perform. For example, in the deltoid, I can isolate the anterior fibers and like block the action of the middle or posterior fibers if I'm going to flex the arm. In the heart, you don't want that because you want to move the blood in just one movement. You want the entire, all the muscle fibers or all the cardiac muscle fibers of in the heart to contract all at the same time. And for that to happen, we need a fast wave of communication between these two cells. We have these are like pores. These are gap junctions between two cells that allow the ions, sodium and calcium specifically, to flow to one cell to the other, and the electrical current can travel from one cell to another really fast, and the contraction can happen at the same time to push and pump the blood out of the heart. Now, these the same coverings or the same layers of connective tissue happening here. These muscle cardiac muscle cells are covered by a delicate layer of endomysium, and a group of these muscle fibers form a bundle. Instead of a fascicle, we call them here bundles, which are these bundles of muscle cells that we can see in here. This is one bundle, another one, another one. The thing is that this myocardium arranges in a specific disposition. Do you see this arrangement is like in a spiral around? First it circles the superior portion, and around and down here it like spirals, in the tip or the apex of the heart. And what we're making sure with this arrangement of cells is that when this superior part of the heart contracts like this, it pushes the blood down. And when this part of the blood of the muscle, cardiac muscle contracts, it pushes the blood in this direction from the apex to the base. And this is important to understand as we explain how the cardiac cycle works. Okay, so let's start describing a little bit of now the gross anatomy of the heart. See you.